I just called the CVS that I prefer to deal with and asked them, and that's when they told me, go ahead and sign up. And on the September the 24th would be the first day that more people could get it. So I got it that day. And I didn't have to wait at all. When I went to CVS, I didn't have to wait at all. In fact, I was in the area early and I just went in there and said, does it matter if I get it a little bit early? I'm still scheduled for today. And he said, no, your timing's actually better to get it done now. So I did. I just feel like, we're doing whatever we've got to do kind of thing. And I think more people take it more seriously than others. And, I do know that having the vaccine may not be a guarantee that you're not going to get it, but there again, it may keep you alive where you more likely to die if you haven't had the vaccine. So, when people give me the argument about how, well, people are still getting it. Yeah, but the difference is it may be what's keeping people alive that would die otherwise. I'm a diabetic and I'm also overweight. So I have cerebral palsy and I also have asthma. All those factors made me feel that I would potentially die if I were to catch it. And I know that people can still catch it with a vaccine, but they have a greater chance of survival if they have the vaccines. So that's why I've gotten the vaccines on the booster, and I'll get anything else coming down the pike that they recommend.
Greetings and welcome to our webinar, Learning to Live Safely with COVID-19 Ask the Expert, where today we'll be joined by Dr. Abigail Klemsz. And my name is Matt Norris from the Center for Health Equity at the Indiana Institute on Disability and Community here at Indiana University, Bloomington. And I am the moderator host today, and I wanted to do a little bit of housekeeping before we begin with our speakers. First of all, I wanted to let you know that there is the availability of captioning. You can activate that by clicking on the CC button. We also have provided through our chat feature in Zoom, the stream text link. If you would prefer to have a little bit more customization to your captioning, you can access the stream text link and do that. And we also have the sign language interpreter today. And please let us know via the chat if you're having any difficulty with that, and we'd be happy to see if we can address that. I just wanted to remind everyone today that we are recording this webinar, and it will be available on our website at a future date. While we will be taking questions during the webinar, we had quite a few submitted in advance, and Dr. Klemsz will be addressing those questions submitted in advance. And if we have time, we can address some of the questions that are submitted via our questions and answer feature in the Zoom platform. And once again, I would like to welcome Dr. Abigail Klemsz and our panelists who will be joining us today. And at this time, I would like to introduce Dr. Jachul Lee, who is the director of the Center for Health Equity here at the Institute. And I want to be turning it over to him to give us a brief update on some of the work we've been doing on the COVID-19 vaccination outreach project.
Thank you, Matt. Thank you for attending our webinar today. Especially today is a Friday, and also it may be a bit early if you live in areas other than Eastern time zone. Our topic is the learning to safely live with COVID-19. We believe this is a really timely topic because these days things are quite uncertain and maybe puzzling. For instance, COVID-19 restrictions are being relaxed or lifted, and COVID-19 guidelines, including masking mandates, are also changing. We also hear about more booster shots and vaccines for young kids. So We're really kind of happy, pleased to have a wonderful panelist and a presenter who will help us make informed decisions about our safety and COVID-19 vaccination. Shannon will share her experience and perspective as a disability advocate. For presenter, we have a Dr. Abigail Klemsz. She's an associate professor of clinical pediatrics at Riley Hospital for Children here in Indiana. She has an expertise in neurodevelopmental disabilities. She is also the assistant dean for academic advising for the Indiana University School of Medicine. Now, I have one announcement for attendees, especially who live in the following 5 states: Minnesota, Wisconsin, Illinois, Michigan, and Ohio. Our institute is one of the 5 AUCD-funded regional hubs for local vaccine outreach to improve COVID-19 vaccination among people with disabilities and their caregivers. In this project, we target FEMA region 5 states, 6, the Minnesota, Wisconsin, Illinois, Indiana, Michigan, and Ohio. But for this survey, we actually conducting survey to inform our efforts to improve COVID-19 vaccination. We target 5 states except for Indiana. For Indiana residents, last month, we conducted an online survey and focus groups. If you live in one of 5 states, with Minnesota, Wisconsin, Illinois, Michigan, and Ohio, also adults age 18 and over, and people with disability, or a family or paid caregiver for a person with disability, please participate in this survey. It will take no more than 15 minutes to complete. Please note, paid caregivers, not just direct support professional DSPs. They include the personal care attendant and home care workers, etc. So if you're interested in participating, please once again complete the anonymous survey. This survey will end in the next Friday. So I think you can see the link, the survey in chat. Also, please feel free to share this link with your friends who are people with disabilities or family or paid caregivers. Matt, I will turn it over to you.
Thank you, Rachel. And at this time, I'd like to introduce one of my colleagues here at the Institute, Peggy Holtz, who will be moderating our discussion with our panelists. So I will turn it over to you, Peggy.
Thank you, Matt. And I want to thank Shannon, who is here with us today. Unfortunately, our other panelist, her whole family has the stomach bug, so that's nothing fun to deal with. So we hope they all get well soon. So Shannon, I'd like to start with having you just talk about why it was important for your family to be vaccinated.
Yes. Well, we have 3 kids, and 2 of our 3 kids seem to be in the category of being at risk. My youngest son has Down syndrome, some lung issues, severe sleep apnea, and autism. My daughter has, right before the pandemic, was diagnosed with pediatric Crohn's and started on immunosuppressants. So whatever we could do to insulate my kids and keep them as safe as possible was our goal. And so vaccination seemed like, a very important part of that.
Did you have any hesitancies about them being vaccinated? And if so, I mean, what did you do to relieve some of those fears or concerns?
I mean, we had concerns. We knew that this is a different type of vaccination, mRNA, and so we just had questions. We looked for reputable sources of information. We consulted with our doctor. Specifically, I had questions about my daughter's autoimmune disease, how that could be affected by the vaccine, or whether it would work for her being on immunosuppressants.
Could you talk a little bit about first your son's experience with you trying to get him vaccinated and just the whole experience of getting vaccinated?
Yeah, it was difficult. My son is 10. It was hard to figure out we had waited so long for him. He was the last person in our house to be vaccinated. We'd waited so long. And it kind of just seemed like chaos when that age group got released to be able to. We tried to make appointments. CVS and some of those places were allowing appointments to be made online, but it did not, you couldn't actually do it because they could not do children of that age. We went and waited in line for hours. No, sorry.
That's okay.
We waited for hours at the Speedway in our car to try and got turned away 2 times after waiting 3 hours to get him vaccinated. It was hard to find a place that was taking children and who might be able to meet my son's needs. He has sensory issues. Ultimately, we were able to get it at Hendricks County Health Department.
Now, did you get both his shots at the same place then?
No, actually, we ended up getting one at the Speedway, the first one. And then we were scrambling to get the second one because they weren't making appointments for the second one at that point either. So we got the other one at Hendricks County after.
Okay. And how did you prepare him for getting the shots?
I think he kind of he knew everyone else had got it. We had talked about it. He's received, flu shots or other things prior. So he was partially excited, but also scared. We just did our best with trying to explain to him what was going to happen. I think when we were waiting in line, the first time was a little bit of a shock because it was a drive-through. And so it was actually pretty helpful to have him in his car seat so that we didn't have to potentially, hold him to have that happen. I was nervous about the second one because we had to walk through and it was just me by myself, and he's 89 pounds. And if he doesn't want to get a shot, it could be very difficult to get him one. But they got a little team together and we were able to get that done.
And he did okay with it, the having to wait 15 minutes afterwards.
He did. He just tried to make friends sitting next to other people sitting there. He did, but yeah.
It must have been really frustrating to wait 3 hours and then not be able to get the vaccine for him.
It was because we were just every day felt like, maybe one day closer to, having some sort of normalcy in our life. That was the goal, and to have him be able to just be more safe.
Mm-hmm. I know we had talked about just how the pandemic has affected your family, and if you could talk a little bit about just the emotional, mental impact that the pandemic has had on your family.
It's been really hard to have to make choices, even between education and health. That's where I felt like sometimes our choices were, where we had to make that choice and doing our best at balancing, still giving my children, access to friends or things like that as much as possible. But there were times it just didn't feel safe, and schools removed masks, and, before, that was really the recommendation from our doctors, and whether that was safe for them to be in those, places. We haven't gotten to restaurants. We, didn't go. We really were pretty much home. We would go outside, bike rides, walks, things like that. We did do one family trip. We took some extreme measures to stay safe, rented an Airbnb with a pool, did not go anywhere, brought all of our groceries with us that we had ordered ahead of time because we were scared of different places, what their mask requirements were going to be, whether it was going to be safe to go in somewhere. Brought a little porta potty set up, which I know is going pretty far, but we just weren't comfortable with so many people not vaccinated, not wearing masks, we had done so much already to protect our kids. So we just wanted to get them all the way through that till everyone could be vaccinated. And when we took that vacation, my son had not been vaccinated yet.
Do you want to talk a little bit about their education and their schooling?
Yes, my son, when we went at the beginning of the year, they did not start with masks at our school. So we were we did not really anticipate that happening. So we were a little scrambling to figure out, contact our doctors, figure out if it would be safe for them just to wear their masks. It was ultimately decided that wasn't safe. The school for my daughter went ahead and enrolled her. They did not have an online option, so they enrolled her in an online option separate from the school. But my son, because he has Down syndrome and autism, that was not something that we could do. So we opted to put him in ABA full-time, where they made special concessions to keep him safe. He was only working with vaccinated, masked adults, really just two. He had his own bathroom area, own place to eat, to keep him safe through that time. He would meet with a teacher at the school after school hours, just 2 to 3 days a week. But I mean, the year before that, we did online for both of them because that was an option through the school district. But I mean, it was very, very tough for your kids not to have interaction with other children in person, except for maybe a few neighborhood kids outside once in a while. And we all know Indiana weather isn't conducive to being outside very often. So, I mean, it's been very hard. I think it's been the most hard on my daughter because, I mean, last time she was in school in person was 5th grade. She'll be in 8th grade next year. So that's a huge gap for, middle schooler.
Right. For those who might not know, could you explain what ABA is?
Yes, it's a therapy that's usually given to children with autism. He goes there and receives like behavior supports to help him be more just able to, he has anxieties, and I think the pandemic's made everything worse for him that way. So they work, it's applied behavioral analysis. So they take his behaviors and they work on them. It's a pretty in-depth option. We were already looking at that prior to the pandemic, but we probably wouldn't have done it full time. But after seeing him home for a year, we felt like he just needed to be out of the house some of the time. So we went ahead and took advantage of this time to work on behavior, since school really was not an option for him to be at.
And I know you had told me that your daughter had made the comment about with her Crohn's disease and about people, she was wondering if people cared about people like her. Could you talk a little bit about that and your concern of if the vaccine was really going to provide protection for her?
Yeah, I think that comment was in regards to, I mean, we have extended family who didn't want to get vaccinated, weren't really excited to wear masks at all. So it was very hard, even on an extended family. And, just going out, and if we wanted to try to get out in public to go in a store when everyone's still recommending that people wear masks, her seeing that people weren't, she kind of asked, like, don't people care about people like me? Because she, didn't understand why it seemed like such a simple thing to do to protect your community, that maybe they weren't considering that there could be, people in the community like her and her brother that could be affected by something like COVID.
Mm-hmm. Thanks. As we wrap up our piece here, could you maybe talk about, if you were to give some advice to families who are considering getting the vaccine for their children, what advice would you give them?
I would say that if you're concerned, if you have any concerns, I would talk to your doctor. I would also make sure that anything that's causing concerns, that you're making sure you're getting information from reputable sources. I think that's been something I've never experienced before in my lifetime, seeing so much disinformation, so, you know, even from family members, you know, kind of confronting some of that, or just, you know, suggesting, I think everyone has a right to have feelings or worries, but, you know, we need to find reputable information to get the answers to those kind of things.
Okay, thank you, Shannon. I mean, your story is so valuable for people to hear, and I want to thank you for taking the time to be with us today. So Matt, I'm going to turn it over to you.
Thanks, Peggy, and thank you, Shannon. And at this time, we are going to welcome Dr. Abigail Klemsz. Jay Chul gave a little introduction to Dr. Klemsz in the beginning of our webinar, and I will turn it over to you, Dr. Klemsz, and let you fill in people as you feel needed, and go ahead and start your presentation at this
Great.
time.
Thank you so much for inviting me today. I look forward to answering questions if I can. And, you know, I'm billed as the expert, but I think you've already heard from the experts. The video that you showed early on, and then Shannon, I mean, they're the experts, so they've lived it. But hopefully I can give you all a little bit more information too. So I'm Dr. Abby Klemsz. You can call me Dr. Abby. You can call me Dr. K. My kids' friends all call me Mrs. Dr. Klemsz because my husband has a PhD. So, you know, it's whatever works for you. So let me get my slides going here. Hang on one second. It worked before, and now I've got to figure out how to get it. There we go. All right. So one of the questions that came in early was, are we still in a pandemic or not? And so I have a picture on the slide here of a person in the middle of a locust, all the locusts, and so swarms of locusts. So I don't think most of us would go outside if there was a swarm of locusts outside. This person did. And then I also have a picture of just one little grasshopper, one little locust. And I think most of us would go outside and enjoy our lives if there was just one grasshopper outside. So a pandemic means that there is a lot of disease all over the world. It's widespread. Endemic means that there's still disease, but it's at a much lower level. And so the flu is endemic. And so we live with the flu and we get flu shots every year. And so the flu's endemic. And so that's what we're thinking is going to happen eventually with COVID, is that it will become endemic and it will become just like the flu. Are we there yet? It depends on who you ask, but I think that most people think that as the number of cases and the number of deaths continue to decline, that we're getting closer and closer to a point where we can quit calling it a pandemic and call it an endemic disease. So people ask about variants. So I have a picture on the screen of a rack of clothing. So like somebody's closet with lots and lots of choices there. So when you think about COVID, when it first came out, they talked about this is COVID. And then the next thing you knew, there was the Delta variant and there was the Omicron variant. And then there's the B and the A and it keeps going on. What does that all mean? Well, every virus has what it's called, it has RNA in it, and that gets mutated. And when that mutates, what happens is it kind of changes its coat or kind of changes its clothes. And so some of those are not a big deal. And it may just say, instead of wearing a gray jacket today, it's wearing a black jacket today. And it's not a big deal. But sometimes it's a huge deal. And sometimes it's, well, today I was wearing a black jacket and tomorrow I'm wearing a bright pink jacket. Well, that bright pink jacket might make that virus more infectious, or it might make you sicker. With Omicron, what we've seen is that it's not really making people sicker, but it seems to be able to be more transmissible. So it seems to pass from person to person more easily. So it's not particularly making people sicker, but it is getting out there in the community. So what does that mean for all of you when you're thinking about, why do I have to get boosters? And why do I have to get a vaccine? And if I got a vaccine, why isn't it protecting me from the variants? Well, if you have a vaccine, you're going to be protected from the virus. And we know that the vaccine helps even if the virus changes its coat. But what scientists like to do is they like to continue to change vaccines, and they will continue to work on this, and they will continue to change vaccines in order to make it so that the vaccine recognizes what the coat looks like. And so that's what they do every single year with the flu vaccine. They try to guess what color coat the flu is going to wear that year, and they try to make the vaccine to match that color. So why do you have to get a vaccine, and why do you have to get boosters, and what does this all mean? So I have a picture of my dog on the screen, who is a very cute miniature golden doodle. And I actually have 3 pictures of him, because you get a vaccine, you get the second vaccine, and then you get a booster. And you may actually, I guess I could have put a 4th or a 5th picture of him up, because we know that there are more boosters. So why do you have to get boosters? Well, the boosters and the vaccine itself, they are what activate your immune system. And your immune system, it's what helps you fight off the virus. So your immune system sees the really cute dog and is protected against that really cute dog. I don't know why you'd want to be protected a really cute dog, but it was better than showing a picture of the virus, I thought. So then you get the second vaccine, and your immune system goes, hey, I've seen that before. I know what to do here. But then after a while, your immune system kind of starts forgetting. And so got to show you another picture of the dog and go, oh yeah, I remember what that virus looks like. I know how to fight this virus. And so that's why you have to continue to, that's why we're having people get boosters, so that your immune system doesn't forget what the virus looks like. There was also a question about isolation versus quarantine. And I think that going to either your state's website or the CDC website, that's the best place to look at current guidelines for timing and those types of restrictions. But I just wanted to explain the terms a little bit. So isolation, if you are sick and you have COVID-19, you need to isolate. And that means that you need to stay away from people. You need to stay in your house, and you need to not have your family have close contact with you, because you don't want to get them sick. And so that's isolation. Quarantine is what you do if, unfortunately, you get exposed to someone who does have COVID-19 and you find out later, oh no, I was with my grandpa and my grandpa has COVID now. So quarantine is, again, when you stay away from people or wear masks, those types of things. And again, I would recommend looking at the CDC website to keep updated with the most updated guidelines. But you protect other people until you know whether or not you actually have COVID. And so most recommendations are then that you would actually get tested about 5 days out. So that leads me to testing. So what does testing tell you? Well, testing tells you whether or not you have the virus. And so it uses different types of technology, and it kind of depends on which test you get, how long it takes for the test to run, how long it takes to get the results back. They're all pretty accurate, and they all can tell if you have the virus currently. And so if you think that you've been exposed to COVID-19, then that would be a good time to get one about 5 days later to make sure that you're not infected. Or if you have symptoms that you think are related to COVID, it's always a good idea to get tested as well. The next thing is masks. And I just have a picture of a surgical mask on the screen. There are so many questions about, should I wear a mask? Should I not wear a mask? What type of mask should I wear? Right now, if you look on the CDC's website, most of the states that you're all from are pretty much in the green, which means that they have a very low level of COVID-19 in those states. What does that mean then? Well, it means that for most people who are vaccinated, who are at low risk for disease, you don't have to wear a mask. Now, if you are at high risk of disease or haven't gotten your full vaccination series, or if you're just worried, should you wear a mask? Certainly, because masks do provide protection, even if it's only one-way protection. So the best way to be protected is if you have a mask on and the other person has a mask on. But if you wear a mask, even if they aren't, you're still going to be more protected than if you didn't wear a mask at all. As far as where to get masks and what type of masks, I would recommend going to your local trusted pharmacy or your local trusted store where you get medical supplies and ask them for what is a reputable mask and which one is the most safe. So staying safe. So we all want to stay safe. And even before COVID, I was one who always had the bottle of hand sanitizer in my pocket because I don't like germs. And so I would take out my hand sanitizer and hand sanitize, you know, after I touched a doorknob in a public building, or before I ate at a restaurant, or if I didn't have access to soap and water and I felt like I needed to wash my hands, I would use hand sanitizer. I think that's probably a very good habit that shouldn't go away. I think that we all need to make sure that we stay safe. And I think that using hand sanitizer can keep you safe. As again, going back to masks, if you are at risk or you feel that you are unsafe, I think that wearing a mask is a great idea. Luckily, here in the Midwest, we are all looking forward to summer, and I know Indiana is a little bit up and down. We had snow on Monday, and it's supposed to be 80 tomorrow. But hopefully we are getting to a point in all of these states where we can spend more time outside. And so for those of you who may not have been going to restaurants, because you didn't want to be inside with a bunch of people without masks on, hopefully soon you'll be able to go to restaurants and sit on their outdoor patios and enjoy a meal. Going for walks, going for bike rides, as Shannon mentioned, those are great things to do and be able to be safe because you're outside and you're much less likely to get exposed to anyone. So I put a picture of my dog up again because he's the cutest thing in the world. So if you have questions, I'd be more than happy to answer them, but I just wanted to give you a brief overview and let you ask questions. So Matt, if you want to help me with some of the questions that are coming in, that would be great.
Yes, I have my questions here, and we did get a few questions that came in, and let me go ahead, since we're talking about vaccination. Here is a question we received. With the understanding that natural immunity is now showing to be more effective, and this is from the person who asked the question, and less likely to cause heart issues, what is compelling, what is the compelling reason to get the shot, especially with the breakthrough cases and the Omicron impact is mild?
So we know that everything is a discussion of risk and benefit. And so if you have questions, as Shannon said, if you have questions about the vaccine or the booster or any of those pieces, I would definitely talk to your own physician about that. But the American Academy of Pediatrics recommends that children be vaccinated and get boosters because we know that the risk of having serious illness from getting an infection is greater than the risk of having a response or an adverse response to the vaccine. And so while natural immunity is great, you don't know if you're going to be one of those people who gets serious illness or mild illness. And again, Omicron may be milder, but again, we don't know which person is going to have a milder case and which person is going to have a more serious case. And so getting vaccinated is the best benefit for the least risk.
Thank you. Here is a question we received. I am vaccinated and boosted, as is my partner. However, they have lupus. Is there a probability that I can give them COVID even if I am negative? Or would it be possible only if I am positive, asymptomatic? I am concerned about an upcoming trip that even if I don't get sick, I can impact them.
So if you are negative, you can't pass on COVID, because if you're negative, you don't have COVID. If you are asymptomatic, there is a slight risk that you're able to pass on COVID, meaning that you have the virus, but you don't have any symptoms. If you have symptoms, you definitely need to stay away from the person and stay safe. Again, I think that if you're going on a trip, then you can use protections to make sure that you are staying safe while you're traveling. And then when you return, some people are, it depends on where you're traveling. Some places are requiring tests for travel and tests for return. So I think that trying to stay safe while you're traveling makes the most sense. But if you are negative and have no symptoms, there's no chance of transmitting it.
Great. Here's another question that we received. If you have had your first single vaccination a month ago, is it safe to get your second COVID shot?
So it depends on which vaccine you're getting, what the interval is. So I would ask your provider if you've met that restriction, but for the most part, 3 to 4 weeks is what is recommended for most of the vaccines. And I think that we will have to keep watching the CDC recommendations for boosters and timing on the boosters.
Great. Here's a couple of questions on the vaccination for children. I heard on CNN that young children 5 to 11 are the least vaccinated. Is that true? And what does this look like for this group in Indiana? And what does this mean going forward as we move out of the pandemic?
So the 5 to 11 group, they are the least vaccinated, and that's mainly because they were only recently able to get the vaccine. And I think that it will take some time for them to catch up. I think that we want to make sure that we're targeting everyone to get vaccinated, because then we can all go back to living our normal lives. And so it's just like with the flu, we need to make sure that we get as many people vaccinated as we possibly can, so that we can be living with this as an endemic disease and not a pandemic.
Great. And is there any consensus? You actually may have answered this, and I apologize. Is there any consensus from pediatricians on the necessity of getting that kids 2 to 5 vaccinated?
So the AAP does recommend vaccinations, and there are actually videos of the leadership of the AAP and their recommendations for having their own children vaccinated. All of my children, they're a little bit older than this, but they've all been vaccinated. And so I feel very strongly that we should get children vaccinated. One of my biggest concerns, though, about vaccinations is that because of COVID, many children missed their well child checks. And so they missed their other vaccinations. And so I think that while we're focusing on COVID-19 vaccination for this webinar, I think that we should also make sure that parents are checking their children's vaccine records to make sure that they're getting their quote unquote normal childhood vaccines on a regular schedule as well.
Great. COVID-19 testing. We have a question here about do the at-home COVID-19 tests work equally on all the COVID-19 variants? Any recommendations for any specific at-home tests?
So I don't think that there's any test that's probably better than any other test. I mean, they all vary a little bit. I think that getting a good specimen is important, and then making sure that you follow the directions as listed on the test itself. But I think that any of those home tests that you can get would be good. You can also get the tests that were given out free, and then there are also testing sites still. A little harder to find sometimes today, but there are still some sites available.
Okay, and I'm thinking of your cute little dog here, but we must have a pet lover here who asked, they tested positive and they're wondering about if there's any new science or research around that contact with their own pets.
So there have been some reports that pets have gotten COVID, but they just get little coughs and cold symptoms like people do. There isn't a risk of transmission from a pet or from a wild animal that we know of. And so if you are sick with COVID, I think cuddling up with your dog would make the most sense because they're going to provide you comfort.
Great. Let me go here. It looks like we had a few around the boosters. And what is the CDC in terms of being fully vaccinated? I know a lot of venues are asking people to make sure that they're fully vaccinated before attending. What is the current CDC definition of fully vaccinated? Is it still the 2 vaccination or the 1 Johnson & Johnson and then the 2?
So I believe that they're talking about having a full primary series and then a booster. And again, I would go to the CDC. We all know that mask mandates are currently changing. Transportation mask mandates are currently changing. So I was looking at the CDC and I thought, oh, I can pull up some of these pretty graphs and share them tomorrow. And then I thought, no, because tomorrow it's going to change. And so everything changes. And I know that that makes it difficult to feel like you're getting the right information. But again, I think the CDC has a wonderful, wonderful COVID website. And they try to keep it updated and it actually updates daily. So I would always send people there.
Okay, great. And since we're on the topic of boosters, what should we know about the recommendations for the second boosters for certain groups?
Again, yeah, so for boosters, I would always talk with your provider because I think your medical provider is going to know more about your specific instance and whether or not a second booster is necessary and whether or not what timing you should have that booster. We all get flu shot. Hopefully we all get flu shots every year. And so I think that we are looking at trying to figure out when we start with that recommendation for COVID as well. And so looking to the future, I think that, we'll hopefully get this to a place where it's endemic and not pandemic, and we can all get our yearly shots and move on with our lives.
Great. Here's a question from our attendees. Can you receive a shingles shot and a COVID vaccination shot at the same time?
I don't believe they're actually, I would have to look that up on the CDC website, which is, like I said, my source of information. I believe with most of those vaccines, though, they're having people wait 4 weeks in between vaccines. But again, I would check the CDC website, but I believe 4 weeks would be safe.
Great. Here is another one. If a positive person does 2 COVID tests within a week and both are positive, does the CDC data show 2 cases of COVID or 1 person with 2 tests?
So until you test negative, you haven't cleared the disease. And so if you continue to test positive within 1 week, that's still just your primary infection with COVID.
Okay. There's another question. What is the difference between Omicron BA.1 and BA.2?
So those are different variants. And so it's like your different colors of coats. And so one is a pink coat and one is a black coat. And it just means that the outside of the virus looks a little bit different. Sometimes variants seem, like I said, sometimes some of the variants seem to be more transmissible. So they go from one person to the next more easily, but that doesn't always mean that they're going to cause worse disease. And so right now, what we're hearing about those is that they do move more easily, but they don't cause more serious illness.
Great. And I guess you could probably speak to the Midwest, even though this question was phrased and from the perspective of someone in Indiana. With the surges of cases out east and some of the masking requirements returning to larger cities out east, what's the picture look like in the coming months for Indiana?
So we are still in the green and cases are still going down. So we think that we are still doing well here in the Midwest. I think that one of the things that we have going for us is that we are headed into summer. And we know that when summer comes and hopefully we're all outside and not passing things as quickly between each other, we're hopeful that things will continue to improve and we won't get another surge.
This seems like a related question. Do Omicron subvariants, are they more contagious? Do they last longer in the air?
So I don't believe that they last longer in the air. I don't think that we've seen any, I have not read anything that has said that. I think that it just has to do with how they transmit themselves to another person.
Great. And this must be someone who was inspired by our title, Live Safely with COVID. What does that mean to live safely with COVID?
So I think it means that you get your vaccines and your boosters as recommended by your provider. You continue to carry hand sanitizer in your pocket because I think everybody should. And you wear masks when you don't feel safe in an environment. And if you're sick, you stay home. I think that one of the things that I've learned more than anything else during this pandemic is that many of us, and myself included, would go to work sick because we thought, well, people are depending on us and we have to be there. And I think that we've learned we can often do things differently and we can stay home when we're sick and we can protect other people by staying home when we're sick.
Okay, looks like I have a follow-up message here from a attendee. I'm sorry, but the answer didn't address my question about data. Does the CDC count this as 2 cases of COVID or one person who had 2 positive COVID tests? Does that make sense?
So I don't know how the CDC is counting their data, but I do know that if you take 2 tests within a short period of time and you are still infected, that it's the same, it's just your same COVID infection.
Great. Here's another question about masking. It seems like the negative impact of masks, germs, lack of air, carbon dioxide, and the lack of evidence that masking has any positive impact, especially the way most wear the mask, wearing them seems to be more damaging than beneficial. I guess they're looking for a comment on that.
So I would recommend that if you're worried when you're out in a situation, especially indoors in a crowded situation, I think that if you feel unsafe, I would definitely recommend wearing a mask, even if it's only a one-way protection, because we do know that masks do protect from COVID infection. As far as the negative effects of wearing masks, as a physician, I wear one, all day long. And surgeons who go into surgery for hours at a time wear them for 12, 14 hours in a case. We haven't seen ill effects from masks.
Okay. Here's seems like a good follow-up. How often should you switch to a new mask?
So if your mask gets wet or if it gets dirty, then I would switch it out right then. Otherwise, you can probably wear it for a day if you need to.
Great. This one seems like they have a little sense of humor. Even though I continue to mask because of my health condition, for the most part, most people in my community have stopped masking. Am I just fooling myself thinking my masking is protecting me?
Your mask is protecting you. So again, it's not as protective as if the other person was masked, but we do know that you wearing your mask is protecting you to some extent.
Great. And here is a question we received. It looks like as organizations are moving forward with hosting events and going back to their normal business practices, here's a good question from someone. We are struggling with deciding to make masks optional or not in our nonprofit program that serves people with disabilities. Up until this point, we have continued to require masks for all students and teachers unless people needed alternative accommodations. We may reduce our requirements for summer programming, which all takes place indoors. Do you have any insights about this dilemma?
So, you know, I think that that's a really hard question, because I think that it depends on how many people within your population are vaccinated. And so once we get more community immunity, then the risk of transmission is going to continue to decrease. But I don't know that we're there yet. And so I think that knowing the population that you're working with and knowing their vaccination status can help in those situations.
Okay, great. Here was a couple of more questions on boosters. Why do we need a second booster? Shouldn't they make the first booster stronger?
So again, it has to do, you know, you guys are going to remember this picture of my cute dog because my dog is very cute, but your immune system doesn't always remember things as well as it needs to. And so that's what the boosters are for. And so as I mentioned earlier, with the flu, the scientists try to make the flu vaccine each year be really good for that variant of the flu. And so hopefully we will get better and better vaccines, but right now we're just trying to stay one step ahead of the virus.
Okay. And this seems like a good follow-up for people with disabilities. Do you think everyone with a disability should get that second booster when it becomes available?
So again, I would have them talk with their provider, because it has to do with what the timing is when they had their last shot and whether or not they've had COVID in the interim. So I would always have them talk to their provider about getting boosters.
Great. And do you think a second booster will be available anytime soon for youth?
So I think that as we move into this next stage, I think that everybody will be eligible for a booster. But I don't know that we'll be calling it a booster at that time. We may be calling it your yearly COVID vaccine. So I think that that'll cause probably even more questions to be raised, just because I think that as we change from a pandemic to the endemic phase, I think that we may change as physicians and as scientists, we'd like to change the wording to keep people on their toes. So I think we may be changing the wording. Do you consider that you're getting a flu booster every year, or do you feel like you're getting a flu shot every year? And so I think it'll depend on how much the vaccine changes each year, whether it's called a booster or a new vaccine.
Okay. And this seems like, you may have already answered this, but we received a question from an attendee. Is there a time estimate for when we will officially change to endemic status?
It kind of depends on which numbers you look at. And so the numbers that I looked at yesterday on the CDC website says that we're closing in on becoming endemic instead of pandemic. It has to do with getting closer to the levels of deaths per day that we see with like a flu as opposed to COVID. And so we're getting close to that. But again, it's one of those things that we'll probably be doing more in retrospect, just because of the fact that we have to see all the data out there first. But I think we're getting close.
Great. And the final question, unless we get another one here in a few minutes here, we have a question from one of our attendees. They just learned that, I guess they found out that they learned that when you take a mammogram and you can't take vaccines because it would effect, a false positive about the cancer. And so they were wondering if they have to wait after the mammogram to take the vaccination. I guess when they're talking about COVID vaccination. Did you?
I've not heard of that,
Okay.
but I definitely know that, after you've had a mammogram, then you should be able to get your vaccine without any problems.
Great. And I think that concludes our questions. And thank you once again, Dr. Klemsz, for joining us today. I don't know if you had any.
Thank you so much.
Great. Final. Well, thanks for joining us. And I wanted to also thank our panelists and attendees. Thank you for our technical producer, Don, who has been putting links in our chat window. And I just wanted to ask Don once again to put in that link to our the COVID-19 regional survey. We're looking for people in the region, Wisconsin, Ohio, Illinois, Michigan, Minnesota, to complete that survey. Jay Chuli talked about it earlier in the webinar. I would encourage people to take advantage of that and click on that link and fill out the survey. At the end of our webinar, we will have a feedback survey. We would like to hear from you how the webinar went. We will be posting this webinar on our website, so feel free to contact us and we can share that information. You can certainly share it with people who you think would benefit from it. And then I would like to encourage you to visit our website at the Institute. Don will put in our link here. We are located on the web at iidc.indiana.edu/CHE for the Center for Health Equity. And we have compiled a list of resources that would be beneficial to anyone, whether you live in Indiana or in other states in the region. And also we would encourage you to follow us on our Facebook page. The link is on our website, but you could always do a search for us in Facebook, the Center for Health Equity at Indiana University. We've been sharing, various news resources about COVID-19. We have some great stories that we have collected from individuals talking about their vaccination experience, and would encourage you to follow us on Facebook and share that information. And once again, we will be ending our webinar here shortly. If you have any questions, don't hesitate to contact us.